Stop. Before you swallow your next pill, I need 90 seconds of your full attention. Because if Losartan, pronounced Losartan, Valsartan, pronounced Valsartan, Amlodipine, pronounced Amlodipine, or Metoprolol, pronounced Metoprolol, is sitting in your medicine cabinet tonight, there is something happening inside your body right now that nobody fully explained to you the day it was prescribed. After 60, these 4 medications are not what they were at 40. Your kidneys filter slower, your liver processes differently, your blood vessels respond in ways the package insert does not warn you about. And tonight, somewhere in the United States, a senior is going to fall in a dark hallway because of a side effect that was never mentioned at the pharmacy counter. I'm going to give you 7 warnings. Warning number 4 is the one that landed a patient of mine in the emergency room at 3 in the morning. Warning number 6 is the silent one, the one no senior on these pills should go to bed without understanding. Roughly half of all Americans over the age of 60 are on at least one of these 4 medications. Half. That is not a small group. That is your sister, your spouse, your neighbor across the street, the man in the pew behind you on Sunday. And here's what no 7-minute appointment has time to say out loud. These pills do not just lower a number on a monitor. They reach into the kidneys. They touch the electrical rhythm of the heart. They reshape how the smallest blood vessels in your body open and close. They change how your brain responds when you stand up from a chair. 4 organ systems, quietly, every single day. The damage stays hidden because it does not hurt, not at first. A swollen ankle is not painful. A heart rate drifting too slow is not painful. A potassium number creeping upward is not painful. Until the moment it is. Until the moment your legs give out in the bathroom. Until the moment your heart skips and you grab the edge of the kitchen sink. Until the moment a paramedic is standing in your living room asking your spouse what medications you take. I am Dr. Klouse Cole. For more than 20 years, I have worked exclusively with patients over the age of 60. And in those years, I have watched patients lose their independence one fall at a time. One missed warning at a time. One quiet assumption that the pill was harmless because the doctor handed it over without a long conversation. I have watched adult children get the call from the emergency room at 2 in the morning. The call no one ever wants. The call that begins with the words, "Your mother had a fall." I know this is heavy. I am not telling you to scare you out of your medication. I am telling you because the alternative, silence, is what gets people hurt. Doing nothing is also a choice. And tonight, you are going to make a different one. Your doctor is not hiding anything from you. Your doctor is fighting a clock. The average primary care visit in this country runs about 8 minutes. In that window, your doctor has to review labs, examine you, manage 3 or 4 other conditions, and somehow explain a medication with dozens of nuances most pharmacists never have time to cover either. The package insert is written in print so small, most seniors cannot read it. The pharmacy handoff lasts about 40 seconds, and the assumption baked into all of it is that you will just take it as directed. But after 60, taking it as directed is not enough. Your liver processes these drugs slower. Your kidneys filter them differently. The other medications in your cabinet interact with them in ways that did not matter at 40. The over-the-counter pills you bought without thinking, the salt substitute you sprinkled on your eggs because you thought it was healthy, the stomach bug you powered through last week without adjusting anything, all of it changes the math. There is something you can do, but it is not what you have been told. Warning number 1. Losartan and Valsartan are cousins, not partners. These 2 medications belong to the same family. We call them ARBs. They block the same hormone system. They lower blood pressure through the same biological pathway. And taking both at once does not give you double protection. It gives you double risk. The pattern I see in clinic is consistent. A patient sees a primary doctor, gets Losartan. A specialist or hospital doctor adds Valsartan during a different visit, not realizing the patient is already on the first one. Names sound different, tablets look different. The patient assumes both must be necessary because 2 different doctors wrote them. Within weeks, kidney numbers drift, potassium climbs, blood pressure drops too low, and nobody can figure out why. Think of it like 2 people pushing the same revolving door. One person moves it just fine. 2 people pushing together do not get through twice as fast. They jam it. Tonight, walk to your medicine cabinet. Read every prescription bottle out loud. If you see 2 pills ending in the letters SARTAN, you call your doctor first thing in the morning. Not next week, tomorrow. Warning number 2. The amlodipine swelling that fools seniors into thinking their heart is failing. Amlodipine relaxes the small arteries in your legs far more powerfully than it relaxes the small veins. Blood flows down into your feet easily. It does not flow back up easily. Pressure builds inside the tiny capillaries at your ankles, and fluid seeps out into the tissue. By dinner time, your socks leave deep grooves. By bedtime, your shoes feel 2 sizes smaller than they did at breakfast. In my clinical experience over more than 2 decades, roughly 1 in 10 patients on amlodipine develops this swelling. In women over 70, that number runs higher, and almost every one of them blames it on something else first. first. Too much salt, weight gain, failing heart, failing kidneys. They scare themselves for weeks before saying a word. Picture a garden hose with the spigot wide open and the drain partially clogged. Water pours in faster than it can leave. Tonight, press your finger firmly into the front of your shin for 5 full seconds and let go. If a dent stays behind, you have pitting edema. Write it down on a piece of paper. Bring that paper to your next appointment. Do not stop the pill on your own. There are dose adjustments and alternative medications that solve this without sending your blood pressure back into stroke territory. Warning number 3, the swelling that is not a side effect. It is an emergency. Stay with me because the warning I'm about to give you is the one I would put first if I had to choose only one to teach you tonight. Losartan and Valsartan, in rare cases, can trigger a reaction called angioedema, which is sudden swelling of the face, tongue, or throat. It can happen on day 1. It can happen on year 3. There is no schedule, there is no buildup. One day you are fine, and the next morning you wake up with your tongue feeling too big for your mouth. The signs are simple: lips swelling, tongue swelling, throat tightening, sudden trouble swallowing or breathing. If any of these happen, you do not call the office. You do not wait until Monday. You go to the emergency room immediately and you tell them the exact name of the pill you take. Cleveland Clinic and the Food and Drug Administration have both flagged this risk repeatedly. It is rare, but once it happens, that medication can never be taken again. Imagine your throat as a doorway. Angioedema is the doorway swelling shut from the inside while you are still standing in it. Tonight, tell one person in your house exactly what these symptoms look like. Show them where the bottle is, because if it ever happens, you may not be able to speak clearly enough to explain it yourself. Warning number 4. Metoprolol cannot be stopped the way other pills can. This is the warning that has sent patients of mine to the emergency room more than any other on this list. Metoprolol slows your heart and reduces how hard it has to work. Over time, your heart adapts to that slower, calmer rhythm. Your body builds up extra receptors expecting that calming signal every day. Pull the medication away suddenly, and those extra receptors are suddenly exposed and oversensitive. Your heart can race, your blood pressure can spike, chest pain can return with a vengeance. In patients with underlying heart disease, this rebound can be dangerous. It is called beta blocker withdrawal, and it is documented in every cardiology textbook in the country. Picture a coiled spring you have been pressing down on for years. Let go all at once, and the spring does not just relax, it launches. If you take metoprolol and you ever decide you do not want to be on it anymore, that is a conversation, not a decision you make in the bathroom one morning. The pill is tapered down slowly over 1 to 2 weeks under your doctor's guidance. Never overnight. Never because you ran out and did not refill. Tonight, count the pills in your bottle. If you have fewer than 7 days left, call the pharmacy in the morning. Warning number 5, the salt substitute in your kitchen that can stop your heart. Losartan and Valsartan both reduce how much potassium your kidneys excrete. Potassium stays in your blood longer, levels creep up, and when potassium climbs too high, it scrambles the electrical rhythm of the heart. Now here is the trap that catches the best patients, the ones trying to be good. Almost every salt substitute sold in American grocery stores replaces sodium with potassium chloride. Most heart-healthy seasoning blends do the same. So the senior walks down the spice aisle, picks up the no-salt seasoning, and starts pouring extra potassium onto every meal, believing she is protecting her heart. The Mayo Clinic and the American Heart Association have flagged this interaction for decades. The pharmacist almost never mentions it. Think of your heart as an orchestra. Potassium is the conductor. Push the conductor too hard and the music does not just slow down, it falls apart. Tonight, walk into your kitchen. Pick up every seasoning, every electrolyte powder, every protein drink. Read the label. If you see the words potassium chloride or potassium listed at more than 10% of the daily value, set it on the counter. Ask your doctor to check a basic metabolic panel at your next visit. The early signs of high potassium are vague: weakness, tingling, a skipping heartbeat, easy to miss, until the rhythm goes wrong. Warning number 6, the silent one, the sick day that destroys a kidney in 48 hours. This is the warning I wish every senior on Losartan or Valsartan had taped to the front of the pill bottle. When you get sick, a stomach bug, vomiting, diarrhea, a bad flu, a hot summer afternoon where you sweat too much and drink too little, your body loses fluid. Your blood pressure drops on its own, and the medication that was perfectly safe yesterday becomes dangerous today. Losartan and Valsartan both depend on healthy blood flow into the kidneys to do their job safely. When you are dehydrated, that flow drops sharply. The medication pulls your pressure lower still. The kidneys are starved, and within 24 to 48 hours, you can develop acute kidney injury severe enough to land you in the hospital. Some of those patients never recover full kidney function. Some of them end up on dialysis 3 days a week for the rest of their lives. Emergency rooms fill with this exact pattern every flu season, every heat wave, every winter virus that sweeps through a senior community. Imagine a watermill. The wheel turns as long as the river flows. Stop the river for 2 days, and the wheel does not just pause. It cracks. Build a sick day plan with your doctor today, not next month, today. Ask one specific question. If I get a stomach bug or I cannot keep fluids down for more than 12 hours, should I hold this pill and call you? Write the answer down. Tape it inside your medicine cabinet, because when you are sick is exactly when you will not be thinking clearly enough to figure this out from scratch. Warning number 7, the over-the-counter pill quietly undoing your prescription. Ibuprofen, naproxen, the little pills for back pain, knee pain, headaches, arthritis. Most seniors do not even think of them as medicine. But combined with Losartan or Valsartan, and especially combined with a water pill on top of that, these anti-inflammatory medications can crash blood flow to the kidneys. Researchers have a name for this combination. They call it the triple whammy. 3 medications, each reasonable on its own, that together can trigger sudden kidney damage in older adults. With Metoprolol, the same anti-inflammatory pills can also raise blood pressure and undo the work your prescription is doing. The Food and Drug Administration has issued warnings. The medical literature is clear, and yet patients take ibuprofen every day for arthritis, for months, for years, without anyone reviewing it. Picture 3 rivers feeding one lake. Each river is fine. Block all 3 at once, and the lake dries up. Open the drawer where you keep over-the-counter pills. Count how many days a week you take ibuprofen or naproxen. If the answer is more than 2, that conversation needs to happen at your next visit. There are safer pain options. Acetaminophen, used correctly, is one. Topical creams, physical therapy, but the routine ibuprofen, taken in silence, has to stop. Let me tell you about Margaret. Margaret was 69, sharp, careful, the kind of patient any doctor would be proud of. She'd been on metoprolol for almost 3 years after an episode of atrial fibrillation, and her heart had been steady the entire time. One Sunday afternoon, she decided she felt fine. She decided 3 years was long enough. She looked at the pill bottle and thought, I am tired of being on so many medications. She skipped Monday's dose. She skipped Tuesday's dose. By Wednesday morning, her heart was pounding so hard she could feel it in her throat. By Wednesday afternoon, she was in the emergency room with her daughter holding her hand. Margaret recovered. Her rhythm settled within 48 hours once the medication was restarted. But she told me something on her follow-up visit that I have not forgotten. She said, nobody ever told me I could not just stop. Nobody. 3 years on the pill, and nobody told her. You do not have to wait until you are sitting in an emergency room to learn what Margaret learned. There are 6 mistakes I see in clinic almost every week. Each one is fixable. Each one is dangerous. Stopping metoprolol cold turkey because you feel fine. Doubling up on a missed dose because you are afraid your blood pressure will climb overnight. Taking your blood pressure 10 times in a row when you feel anxious and panicking at the highest reading. One number is not a verdict. Using ibuprofen for arthritis every single day and never mentioning it at the doctor's office. Adding a salt substitute to your diet without checking the back of the jar. Standing up too fast at 3 in the morning when your bladder wakes you without sitting on the edge of the bed first. If you've done any of these, and most of my patients have, do not panic. You are not in trouble. You are exactly where most patients on these pills are. The difference between the patient who gets hurt and the patient who does not is one phone call. The clock is running, but it has not run out. If you take Losartan, Valsartan, Amlodipine, or Metoprolol, here's the one thing I want you to do this week. Sit down with a piece of paper, write down every prescription bottle in your house, every over-the-counter pill, every supplement, every salt substitute, and next to each one, write one symptom you have noticed in your body in the last 3 months that you have been quietly ignoring. Ankle swelling, a cough, dizziness on standing, a skipping beat, a new tiredness, a cold feeling in your hands. Bring that paper to your next appointment. Hand it to your doctor without saying a word. That single piece of paper changes the conversation completely. In the comments below, tell me which of the 7 warnings surprised you the most. I read every comment. I use them to decide which video to make next. Subscribe, because the next video covers the 3 nighttime habits silently raising your morning blood pressure by 10 to 20 points before you have even had breakfast. This video is for educational purposes only and is not a substitute for personalized medical advice from your own physician. Always consult your doctor before making changes to your medications, supplements, diet, or routine. I am Dr. Klouse Cole. Take care of yourself. You have a lot of good years ahead of you.